You may have heard it called things like the vampire lift, the Y lift, the space lift, or the liquid facelift. No matter what name it's called, the procedure usually uses fillers to make your face look a little younger and a little fuller. Dr. Stephen Hopping is here to explain to us, and welcome. Good to see you.
Hi, Barbara. Happy Friday the 13th.
Yes, I know. We've been talking about the scary part of that, but we want to make this less scary for women who might be considering doing this. It's not undergoing the knife, it's undergoing the needle instead. We've talked a lot in the past about volume. We were just talking about that last week. Tell us, is there a problem with overcorrecting or using this too much?
Absolutely. I mean, one of the issues that we're seeing today is that people are getting overcorrected. They're sort of blowing up the face to try to correct for volume loss, and that's not how we used to look. So, yes, overcorrection is definitely an issue.
Well, then let's just talk now about questions you should ask a doctor. If you're looking for one, should you go to a doctor, or can you have it done? And I know beauty salons are offering some of these things. And who should you seek information from?
Well, I think it's a big issue. You know, a lot of people are injecting. Dental offices, salons, estheticians, but this is a treatment, and there are complications. There can be infections. There can be contamination of these needles. There's HIV concerns. There are AIDS concerns. There are hepatitis concerns. So please go to a board-certified. If you're in a salon, fine, but make sure it's a board-certified doctor doing it. Board-certified plastic surgeon, board-certified dermatologist who does a lot of this.
And do you have to have a specific license to do these injections?
No.
You do not?
Any doctor. Any doctor can inject fillers.
But a beautician or someone who has gotten some training is not supposed to do it?
They are not
It's
permitted.
against the law?
It's against the law.
All right. So
physician assistants can, advanced nursing degrees can, depending on the state.
So let's talk a little bit about the fillers now. Is there a difference in the fillers? And should you go to a doctor and ask for a specific type of filler? Because we're seeing them advertised on television
Sure.
now.
No, just today I have a headpiece. This is Voluma. This is the latest and the greatest filler. And people are coming in, I want Voluma in my lips. Well, Voluma is not approved for the lips and shouldn't be used on the lips. So it really depends what you want. If it's fine lines around the lips, then we like things like Belotero that we've talked about. If it's just for volume of the lips, then we like Restylane or Juvederm. But if it's volume in the cheeks, then Voluma is the
Okay, so you say this is the newest, it's the latest and the greatest. What makes this different from all the others that we've been hearing about?
It's sort of the third generation. It lasts longer. The others last 4 to 6. Here we go. Here we are, the liquid lift. You can see how, you know, immediately adding volume to the cheeks. This is Voluma. It really does make people look younger. Not 10 years younger like a facelift might do, but certainly 2 or 3 years younger, which is fabulous.
So should you go prepared to tell your doctor where you wanted to go, or should he or she be able to tell you how to make you look better?
Sure. Well, that's a good question. Yeah, people come in, they have an idea, but you have to listen to what the doctor's recommendations are, too. For instance, there are certain areas we shouldn't use Voluma because it's not approved there, or it might cause a problem. So you have to have it's a give and take.
And tell me why Voluma is new and the latest and the greatest, as you call it. I know this is not an ad for Voluma.
It's not.
But it does some things that other things that the other fillers
basically,
don't
there are
do.
2 classes of fillers. There's the more superficial fillers for the lips and fine lines, Restylane, Juvederm. They last 4 to 6 months. The fillers that add volume, like fat, Voluma, Radiesse, Sculptra, they last about a year, and this supposedly lasts 2 years.
Oh, 2 years. That makes a difference with the
There
price.
can be serious complications with this. It doesn't happen very often, but sterile technique must be adhered to. Infection is the big concern. Lumpiness. There is an antidote to this. So if you're overcorrected, we can reverse it.
Is this the only one that has an antidote?
The only one.
Oh, wow. Okay, well, that makes a huge difference. You always give us the straight answers, so thank you, Dr. Hopping. Good to see you.
Thanks, Barbara. Have a good weekend.
You too.